Good morning. Guten Morgen. Please take a seat. We're going to get started. Don't shy from sitting in the front. We are in a very, very big room. And it's nice to see the audience from the panel when we speak. Great. Good morning to everybody in Berlin. Good afternoon, good evening, and good morning if you are joining us online from wherever you are. My name is Katri Bertram. I am here with the privilege to moderate today's session on global health strategies. And I work for I would say, a super cool NGO called Light for the World, which focuses on disability rights and eye health through an integrated and systems approach. And I'm here to speak about global health strategies, but also in my function from my organization and civil society to make sure that whatever we design and implement and decide is also inclusive of all populations. And maybe just to give you a small statistics, because I was not aware of this before I started my current job, I always thought that people with disabilities, they're an important group of people in our societies, but I thought it's a very niche issue. And I was really struck by one statistics from the World Health Organization, which is that 16% of the global population live with a disability. And so it's not a niche population, it's not a niche issue. And I think when we're discussing strategies and government and regional approaches as well, it's very important to bear in mind how many people are still excluded from all of these processes. I would like to thank Germany and France, who are co-hosting this session today, so thank you for having us here. And we'll be looking in today's session at global health strategies from a European perspective. So I hope next year we'll also take into account strategies that are being developed in other regions as well. The most prominent ones have been in the African Union, which you might be aware of, but also other regions are developing global health strategies. So today's discussion is really a bit from a European perspective. And to kick us off, I consider myself a strategy nerd, but I do recognize that some people might find strategies a bit dry, a bit boring. I don't think the panelists here will agree, but just to give you a bit of a definition of what strategy means, because I've also in my career realized there's a lot of misunderstanding on what a strategy is. And the easiest way I find to define a strategy is to start with what it is not. A strategy is not a summary. So many strategy documents that you read will have hundreds of pages, and they're a list of current activities. So they're a bit backward looking, or they summarize what an actor is doing. That's not a strategy, that's literally just a summary. A strategy is also not a set of superlatives. So sometimes when you look at a strategy, you think, wow, this is amazing. We're going to change the world, we're going to have a healthy planet. That strategy is what I think the English term pie in the sky defines. It's completely disconnected from anything realistic. It usually has no action plan, no financing, but it's a good moment to be celebrated when you launch it because it just looks good and everybody thinks, wow, cool. So that is not a strategy. So a strategy in its most traditional definition is a clear, concise plan that lists your theory of change, your value add, and your objectives. And coming from civil society and having been in the space for quite a few years, I always thought strategies are great advocacy tools. You involve different stakeholders, you try to get your special issue or word in, you celebrate the success. And the longer I've been working here, the more I think that's actually not the purpose. The purpose is it's an accountability tool. A strategy is a way for governments, for regional stakeholders to commit to something. And from the civic society space, again, it is our job primarily to look at, are those commitments being delivered? Because if they're not, we will have situations as we have now, in terms of the SDGs, but also our health outcomes, that we are not delivering. We're not progressing on many fronts, we're stagnating, and we are even regressing. So a strategy is a really, really important accountability tool, and I would just encourage everybody to use it as such. And before I introduce our esteemed panel and we kick off the discussion, I just want to say a few words on the context we are in 2024. Ignoring a context means, again, that you have a paper that is completely disconnected from the reality you are trying to implement in. So a strategy that was developed maybe 20 years ago or even 5 years ago might require an update as the world changes. I often describe a strategy as a map. It's a way to define how you get from here, from our current context, to a vision and a target date. And the world changes, as we know, and we've been discussing over these days, in a way that is fundamental at the moment. So there are eruptions of conflict, we have the climate crisis, all these other fundamental factors that are changing in terms of the political and funding context. And if we ignore those, it's a bit like having a map where volcanoes and waterfalls are erupting in reality, but you completely ignore them, and you are just set up to fail if you don't acknowledge that. So that's a really important point that I just want to put here before we kick off. I'd like to hand over now to people who are really experienced in developing strategies, in living them, who hopefully feel accountable for them as well. And I'll briefly introduce our brilliant panel here today. So next to me is Lorena Boix-Alonso. It's a pleasure to have you here. She is Deputy Director for Health in the Directorate General for Health and Food Safety, DG Santé, at the European Commission. She previously worked in the Directorate General for Communication Networks, Content and Technology, DG Connect, and began her career in the European Commission in the Directorate General for Competition. And she is a lawyer by training. Next to Lorena is Professor Dr. Beate Kampmann. Beate is Professor of Global Health and Scientific Director of the Charité Center for Global Health and the Institute for International Health at Charité's Virchow campus. She was previously Chair in Pediatric Infection and Immunity at the London School of Hygiene and Tropical Medicine, where she directed the Vaccine Center. And during her time at the London School, she divided her working time between London and the Gambia, West Africa. And a small anecdote on Beate: before she came to Berlin, one of my very prestigious international health colleagues said, "There's one person you have to meet in this sector, and that is Beate." So your reputation preceded you coming to Berlin, and we've heard great things about your work that you've done here so far. Next to Beate is Roland Dries. I don't think he needs a lot of introduction for those of you who nerd out watching live streams of international health negotiations. He's the Director for International Affairs at the Ministry of Health, Welfare and Sports in the Netherlands. He has served as health attaché for the Netherlands in Geneva, led the EU presidency of the Netherlands, served twice as bureau member to the Framework Convention on Tobacco Control, and was until recently co-chair for the INB, the Pandemic Treaty negotiations. Next to Roland is Dr. Jérôme Weinbach. Pleasure to have you here as well, and thank you for hosting us. He is Deputy Director for European and International Affairs of the French Social Ministries, which include the Ministry of Health and Prevention. He also leads European Joint Action, founded a year ago to maximize the impact of the European Global Health Strategy in coordination with national strategies. Thank you for being here. And last but not least, Dr. Thomas Steffen, who is State Secretary at the German Federal Ministry of Health and has been so since 2019. From 2012 to 2018, he was State Secretary at the German Federal Ministry of Finance. Dr. Steffen studied law and political science and has a doctorate in comparative law, and I see is also a fellow alumni of the London School of Economics. So pleasure to have you here again with us. So we are going to have a bit of a panel discussion, but it's also very important for all of us to make this session as interactive as possible. So whatever your preferred communication means and tools and accessibility is, please do prepare as well while you're listening to our discussion here on the stage, any questions or comments you may have, because I will be opening up to the audience here in Berlin after our discussion. But first, we'll kick off with a couple of questions, and I will start with the State Secretary, Dr. Steffen, if he doesn't mind. We are in Germany, in Berlin here, who are those of us who are physically present at the World Health Summit. And Germany was one of the first countries to develop a global health strategy. So in 2020, it was launched, and Germany is currently going through a midterm review. We'd be interested to hear on a session called Global Health Strategies and Worldwide Impact. Have you already seen any impact, and where do you feel that the value add of the Global Health Strategy lies? Over to you. Thank you.
Many, many thanks, Madam Moderator. It's a pleasure to be here and to discuss global health strategies. And it's also good to have the discussion, of course, with all of you, because I agree with you, we should have it as an interactive discussion. But I'm also very happy that the Netherlands and France, together with the European Union, are with us for the simple reason that, to my surprise, there are only 4 countries in the European Union having a global health strategy. It's the Netherlands, it's France, Sweden, and Germany. And that is why, indeed, we should further discuss how we can, maybe together with the European Commission, reflect on 27 countries having a global health strategy, just to bundle our forces. First point. The second point is, of course, we have seen already huge impacts by our national global health strategies, because we are discussing the objectives behind the global health strategy with many of you and with many partner countries in developing and in developed countries. So that, in my view, illustrates that there's a huge interest to do something together on a global basis, and not just to stick to the national health strategies we all have in place, for many good reasons, by the way, because most competences in health policies are national competences, because they are only national patients that we have to look for. And naturally, politicians, policymakers, they concentrate very much on the national problems and how to improve the national healthcare systems. And I would never criticize that, because this is our first priority. But we have seen in the past few years that there are new and emerging threats, cross-border threats, that we can only tackle together, and not just with national thinking and national competences. And that is why I feel it's so important to reflect further about global health strategies. And just to pick up what Katri just said on the strategies itself, it's not sufficient to have a strategy, but it's also very important, what you indicated, to have an implementation plan behind the strategy. So, you know, just to quote Bill Clinton in one of his campaigns, it's the economy stupid. I would like to change it by saying it's the implementation stupid. If you have a strategy in place, this is nice to have, but you really have to develop action plans behind that, to see how we can implement it step by step over time. And of course, to keep it as flexible as possible, to adapt it to the changing times that you rightly referred to. And that is what exactly we are doing in Germany, together with our European colleagues and friends. And I guess there's a lot of room for maneuver to reach out to further countries to see how we can do something together. Maybe a last word on the objectives behind the strategies. And maybe they differ between the Netherlands, France, and Germany, and I think this is fine, because we are all still, let's say, trying to find the right way forward. And that is why maybe strategies and objectives can differ. And just to illustrate that, in Germany we're talking about 5 objectives, and I would be more than happy really to discuss these 5 strategies, not only within the panel, but also with the audience, whether these are the right objectives or not. And just again, to illustrate, these are not objectives which are set in stone. They should be as dynamic as possible. The first one is prevention. The earlier we start with prevention, the better it is also for the health systems and for the patients. The second one is on innovation and digitalization in the health systems, which illustrates that we can learn from each other. Germany is one of those countries not very developed sometimes in digital developments, so we are very much interested in the view of others and then to see how we can copy that to our health system. The third one is about new cross-border threats and health security, which illustrates that we are not living on an island, but we really have to reflect how we can bring more stability to the systems and to be better prepared against cross-border health threats. The fourth one is about the major issue of climate change and health-related issues together with climate. It illustrates out of itself that it can never be solved just on a national or a regional level. It is a very, very global issue where we really have to see what we can do together. The last point is also about investing in resilient health systems. Resilient health systems in the sense that we need functioning systems with, let's say, good health workers, highly skilled health workers, people and processes in place that really look after the patients and improve the systems step by step. So the resilience of systems, the systematic approach, in my view, is maybe already the almost most important approach. Maybe you have seen that yesterday there was the Nobel Prize for economic sciences. It's all about functioning institutions in developing countries and developed countries as a prerequisite for health, for wealth, and for prosperity of nations. And I would include, in that respect, functioning health institutions as one of the priorities for the prosperity of nations and of economies. And that is why I find it so important to do something together, to have more investments in more resilient global health systems and national health systems. Thank you.
Thank you Thank you so much, Mr. State Secretary, and I think many of us in this room will agree on the importance of systems and how much it's still neglected, and thank you as well for calling out things like health workers, because we're so interested in innovations and products that we sometimes forget that's the only way we're able to get those products and innovations to the people we need. I'd like to pick up a couple of points just from your statement. Firstly, congratulations for remembering the 5 objectives without having to cheat. That's already a great testament that the strategy seems to be sensible, because many strategies as well have 87 subpoints and 15,000 targets, and nobody can remember them. So a general good rule of thumb is you have not prioritized and focused if you cannot yourself remember the objectives you've set. I think a second very important point that you've made is on the implementation plan. I think that's absolutely critical, and again, for all my fellow advocates and civic space stakeholders in the room, do check whether there's an action plan, whether it has time-bound targets. And I think another point, you mentioned the word investment as well, is it somehow funded, right? Because again, if you have a great national action plan and a great strategy, but there's no financing behind it, it's just a great plan, and that's the way it will stay. So many countries, as well as you'll very well know, have thousands of national strategies. So they compete with each other for very scarce resources. So many organizations or even sectors have started creating what are called investment cases to make sure that the financing has also been thought through. And finally, I would just like to applaud Germany's way of consulting different stakeholder groups. I've seen this from both sides of the table in the last years, and I think this is really, really important. as a best practice for all countries who are developing strategies. So often, organizations such as NGOs, civil society, and other patient groups who really are the users of all of these services get ignored, and not consulting them is just bound to fail in terms of impact and implementation. And I also would just like to highlight your point that countries where the strategy is to be implemented as well, so for example, low and middle income countries, they have to be consulted. It has to be a needs-based strategy. So anything top-down that is designed academically might be solid and great, but is usually quite irrelevant. So thank you so much for your points. I'd like to move to Dr. Weinbach. France adopted its global health strategy a few years later than Germany in 2023, and so this was in the aftermath of the COVID pandemic. And so I think we would be really interested as well to hear whether you designed and the strategy was informed in a different way because you had a fundamental global health crisis just ahead of the launch. And so does your strategy in some ways differ for that reason, for example, from the German one? Thank you.
So thank you very much, Katri. As an introduction, maybe before coming to the changes that were induced by the aftermath of the COVID crisis, I would like to come back on your comments and Thomas Steffen, Staatssekretär, comments that were very interesting. In my view, the first and foremost advantage of having a national or European, regional global health strategy is that this strategy, they set a framework for collaboration. They set a direction, including budgetary commitments, for a given period, which can withstand political changes, because political continuum is very important, and we have experienced sometimes quite painful elections, and there are still elections to come in other countries. So we have to monitor this. The strategy helps. And also a drop in attention after the end of the pandemic. So that's helpful also for these reasons. Our updated global health strategy was adopted, as you say, in 2023, but it took 2 years to prepare. And this was done in a co-design process involving from the beginning, not only all ministries are concerned or contributing to global health activities and funding, but also all actors of our civil society in France that contribute to global health program, projects, and so on. That was extremely important, so that was a more inclusive approach. And this is something that was also brought in the aftermath of the COVID crisis. We need territories, we need societies at all levels to be involved in the strategy design and in the strategy implementation. As a result, we were able to take into account all the phases of the COVID-19 public health emergency of international concern to shape it. We were preparing for 2 years on this strategy, so all the steps were also experienced during this preparation. The pandemic exposed global vulnerabilities, as you know, and underscored also the importance of a coordinated, resilient global health system. And this experience influenced the following key changes in our French global health strategy. First, of course, strengthening pandemic preparedness, response, and prevention. This strategy emphasizes building global capacity for early detection and rapid response, surveillance also, to pandemics, highlighting the need of robust disease surveillance systems. Not only for infectious disease, but also for non-communicable disease that suffered so much from lateral effect and a loss of chances during this crisis. France now actively supports global initiatives like the Team Europe initiative. We are working together with different member states in the field, and the World Health Organization Pandemic Fund, for instance, to ensure rapid mobilization of resources. Then One Health approach came on the agenda, and very high, and that's true also for most of the strategies of member states and the Union. Equitable access to health resources, because during COVID-19 disparities in access to vaccines, for instance, and medical countermeasures were really at stake, and equitable access to essential medicine and vaccine was so important to support local, notably to support local production of capacities, and that's the goal of some Team Europe initiative in low and middle income countries, to reduce dependency and to ensure timely access during a crisis to safe and efficient medical countermeasure. Then focus on resilient healthcare system is also one of our priorities in this strategy, because COVID-19 crisis showed that robust health infrastructure is critical to manage emergencies, and the strategy places the emphasis on supporting partner countries in building resilient, accessible, and universal health systems that can correspond effectively to future health crisis. So we have chosen not to limit our strategy to PPPR issue. On the contrary, one of the main positive points of this timing is that we can put in that way, is that we have seen the gradual decline in the attention paid to global health once the worst of the pandemic has passed, and then we have therefore paid even greater attention to prioritize the relation and between the project for the achievement of universal health coverage, as this is for us the only horizon to make it possible to respond both to emergency situation and to the strengthening of health system in the long term. So furthermore, and I will finish on that, defining monitoring indicators, and this is something we should discuss, and document the results of this strategy after implementation, which is also very important, seem to us essential for reporting on our strategies, impact, and possibly adjust it when it is necessary. So we wanted these indicators not too numerous, simple and easy to fill in for the contributors. And hence today we have associated to this strategy 17 indicators, and we are ready to share it and to share our experience with other member states and the Commission that were created last year. And we will then calling at the same time for comparable indicators to be shared between the different global health strategies, so we can work together and make progress also together, thanks to this indicator. Thank you very much.
Thank you so much, Dr. Weinbach. And I think for anybody who works with indicators or key performance indicators, 17 for a whole strategy is actually not that much. So usually, again, you would have maybe 240, which are irrelevant then for accountability purposes. So thank you for highlighting that aspect. Here too, I would just like to underscore the importance of including different stakeholders in the design process, so I'm really glad to hear that. And I think 2 points in terms of reflection from your statements. One is, and I know this from the German context as well, a strategy is an important tool to coordinate what is sometimes a very fragmented system. Nationally, if you have worked with German stakeholders, you'll be very aware of this. There are many ministries, many different parliamentary bodies, but also others you need to engage and consult. There is no one quick fix. In case anybody in the room was hoping for it, that one person to go to, that doesn't exist here. So a strategy really does create that coherence and bring together the stakeholders in a coherent way, and I think that's a very important purpose, at least in these countries that we're speaking about today. And the second point I would really like to underscore here too is, especially after a pandemic, I'm sure there was quite a kind of political pressure to focus even more on, let's be even more specific on disease surveillance, on pandemic PPR. And I think it's really applaudable that France has kind of done exactly the opposite, to say we will focus even more on the system's dimensions. You mentioned the word equity, access, and also universal health coverage, which many of us are very strong advocates for. So I think that was very striking when we watched the launch of the French strategy as well, to see that you still considered the big picture, how to make sure pandemic PPR doesn't overtake the agenda either, because there are other health needs that need to be addressed as well in a broader context. So thank you for contributing those statements. I would like to jump to Lorena, if I may, because I have a bit of a different question for Beate. But the European Global Health Strategy was referenced by both the State Secretary and Dr. Weinbach as a way to align. I will come to you, Roland, as well, but I have a very, a bit of a hot potato issue, so we'll keep that for the end. Do we even need national strategies anymore? We have this EU strategy. I think Dr. Stefan said, you know, instead of having 27 national global health strategies, maybe we could just use the EU one. What's your take on that?
Thank you very much, Katri, for the challenging question. I think we need a coexistence of both the national strategies and the European Global Health Strategy. That's basically the richness of the European Union, that we have 27 member states with sometimes different needs, different strategies, and the objective of the European health strategy is precisely to align the efforts of the member states with the efforts of the European Union to create synergies, to see where and who is stronger in what field, and then make the efforts a common effort, but also to use this diversity aligned to create what we very proudly call the Team Europe, which is basically having a unified voice in the discussions at international level. And it's also very important, I would say, for financial reasons, because we at EU level, we are making a strong contribution financially to global health, but also member states. So it's a way also to align efforts and to make very good use of spending. So I would say that it's coexistence is very important. And it is true that the European Global Health Strategy was also designed and created in the aftermath of COVID, and was a way to show that there are situations in global health where even if you want, it's impossible to act alone. So you basically need to work together. And for that purpose, it's good to have a coordinated approach. As Jérôme was calling it a framework, I like to give us example. We are often giving us example of why we created together with member states this strategy, how we acted on the vaccine during COVID-19. But I like another example that also because you were saying before I was appointed Deputy Director General in DG Sante, I was working in digital matters, including e-health, which is the COVID certificate. That for me was a wonderful example of how this can work. At the beginning, and with my team in DG Connect, we were very, very closely involved in the digital side of the tool. At the beginning, it was normal first reaction. Not only member states at national level were developing their tools, but even at regional level in many member states, developing different tools. Until we identified, we all had the same objective, which was to do something easy, secure, and privacy-friendly, of course. And then by doing it together, you, of course, meet the objective of each member state and even region, but also make it even bigger because you make this compatible at EU level. And then the beautiful thing of it is that then we offer it to the WHO because it was seen that this was something that could be leveraged at international level. So for me, it's a very nice example of how at the three levels, you show that working together is much better. Well, I don't know if you want me to develop more, but
yeah. Thank you so much. And I think that's a really important additional point that you make, Lorena, on speaking with one voice. The European political context is fragmented. It's also becoming increasingly polarized. I do know that there were great challenges as well in the negotiation process, even on the EU Global Health Strategy, to get it adopted. And I think that was also an important tool to get different European countries with different political contexts in these current times to agree to common positions or a framework, as you said, and also to use that voice in international organizations. So I think those are really, really important points. And also thank you for sharing the very concrete case of the digital COVID certificate, just to give us a feel for how European coordination can very practically work together as well. Beate, I would like to come to you before I hit Roland with some tough questions on political context. When reading global health strategies, especially the European ones, whether it's national or European, it sometimes feels like we're still reading a document that is not a global health strategy. It's a strategy for international health assistance or cooperation. So it's more a development cooperation strategy. So I would love your take. How do you perceive the global health strategies? Are they really global? Are they really addressing global health in the way I think the World Health Summit has defined global health, I think in the way that WHO would define global health? Or are they still a bit maybe dominated also by where much of the funding is, and the model behind global health still continues to be, which is a kind of development assistance model? How would you see the...
Well, thanks, Katri, and thanks for putting all that weight on my shoulders of saying something really meaningful here. I don't have a PhD in strategy analysis, just to make that very clear. As an academic, I see these things maybe a little bit more from an observational standpoint, and also how we as academics feel that we can make an active contribution to what sometimes feels like a very remote process. And I was asking myself exactly the question that you've just put to me. And the first question is, who is the strategy for? Is it for your country? Is it for the community in which you work? Or is it actually a generally agreed global concept? And, the question whether we need national strategies when we've got a European one, then the question is, do we need a European one if we could come together for a global one? But in a sense, it aligns the thinking, I guess. So, the strategies I would wish for would be strategies that not only have an implementation plan, but that also have measures. And, you mentioned the implementation plan, which is absolutely essential, but we do need to ask ourselves, what are the strategies achieving? What are the priorities that we've set as a global community? And because the priorities that you set here in the German strategy, prevention, innovation, health security, climate change and health system resilience, everybody in the room would agree to them. So what do we do beyond that basic agreement for something that resonates with the global community? And we had a very interesting session with the GLORA people yesterday, which is the German Alliance for Global Health Researchers. And we had a participant on the panel who was representing the African voice. And to them, a lot of stuff that we talked about in this strategy, even between Germany and France, didn't make much sense at all. Mm-hmm. It wasn't hitting their priorities. So that's why, for me, the first question is, what is the strategy for? And I agree with Lorena, of course, that it is a mechanism to also align funding streams. Mm-hmm. And as academics, we are hugely interested in funding streams because we need to fund the research that we want to do, and we are not going to get funding for areas that have not been prioritized between our various governments in the stream of global health. But I think it's absolutely vital that we reflect on our own strategies in the context of what is happening beyond our national interests. And even within the European strategy, there was quite a lot of criticism that it was quite inward-looking. It was primarily European. It was primarily also a health security issue. And yet we should be aligning the European and our national strategies with the global health agenda, which is probably around the Sustainable Development Goals. I mean, I think that is, if you had to come up with a global strategy, that would be the overarching strategy it already is. So rather than coming from the national, and I'm so glad I don't have to write these documents, I can just comment on them and criticize them. Rather than coming at it from the national perspective, we should be coming at it from the framework of the global perspective, and then narrow these things down of what, as nations, as European community, as national institutions, we can deliver in measurable output and input into those strategies. And I guess, our French colleagues have picked that up in a little bit more detail, although I'm really worried about that catalogue of measures now, although you said it's a small catalogue. So that's for starters.
Great, thank you so much, Beate. And I think you've made a couple of really important points. Are these global health strategies really global if they are all taking place at a national level? So if we would take this as a model for all countries, would we end up having 193, 194 global health strategies? And what does that mean in terms of coherence? I think it's a really important point. And also in terms of just maybe building on your point of influencing and critiquing, I was still thinking of Lorena's point on why we need a EU global health strategy if we could just do this at national level. I mean, just from an organizational perspective, we're a small NGO. We're not able to influence all 27 national strategies, but we are able to influence, for example, the EU global health strategy. So Light for the World at the time worked through a European Disability Forum Alliance to influence the accessibility in terms of design and implementation as well. And I think for many countries, especially for many stakeholders, especially if you are not in Europe, to say, where do I influence what Europe is doing, if it is Team Europe, you go to the European Commission instead of going to each and every individual country. I'm struck by your comment, Beate, that you found the European Global Health Strategy very pandemic focused. I actually read it very differently because I was very happy to see similar elements as in France, that there was health system strengthening, universal health coverage as one of the main pillars. But it's also interesting to see how different those perspectives are. Yeah, I think you've made so many great points that we can pick out in the discussion further. And again, we're starting to broaden the perspective slightly. But, Roland, I'd like to take this back to the national level. And one issue with the global strategies is, as the State Secretary and Dr. Weinbach pointed out, they provide continuity in times of political instability and short-termism. And you are from a country where there's currently just been an election, quite a big political shift for those of you who have followed from a traditionally, I would say, very supportive kind of donor perspective, but also very progressive on many of the issues such as equity, access, issues such as sexual reproductive rights. And we now have a very different government in place in the Netherlands. So in your perspective, I'm just looking up, the strategy was adopted in 2022. Do you feel that the strategy provides that kind of safe continuity in times where there is some political, I wouldn't even say shifts, I would say it's fundamental pivoting at the moment? Or how are you navigating this situation at the moment, if you're able to share?
Let me start by saying that I'm a loyal civil servant, so I serve my government as much as we can, of course. But let me first go back to your introduction in the beginning, and it made me a little bit nervous when you started elaborating over what a strategy is and what a strategy is not, and you said some things about it as well. And I said, what is our A and what was our B? What was the where did we start and where did we want to go? And those fundamental questions we discussed, of course, at the beginning. But it's always good to remind yourself why you do something. And I think why we came up with a global health strategy is because what we saw for a long time is that the Ministry of Foreign Affairs and Development Aid and the Ministry of Health both acted on health in the rest of the world and did their own things. And the striking example for me was always that my colleagues from Foreign Affairs were very active when it came to fighting AIDS, fighting tuberculosis, and we were very active from the Ministry of Health in trying to combat antimicrobial resistance. And they said, oh, that's your thing, that's not our thing, they said. And that is so wrong, because, I mean, people who have AIDS, they often die from tuberculosis, and why do you do not cure from tuberculosis? Because it's resistant to to antimicrobial solutions. And so it makes a lot of sense to combine your insights, combine your efforts, and work together in that respect. So the main focus for me is that we align what we do from a perspective of development aid and foreign affairs and from a health perspective. And what's also interesting is, at least I think it's interesting, is that it was not us, the civil servants, who came to that enlightened insight. It was parliamentarians, and actually they fed into the new government, or the last government we had, and they said, we need a global health strategy. And of course, the pandemic helped a little bit in that respect, because it made very clear for everybody that the rest of the world and the health situation in the rest of the world is very much of influence of what happens in the Netherlands. So, but we needed that push actually as civil servants to get there. And now it seems like a normal thing, but it was not for a long time, and it's not a perfect situation still. We do our best in this respect, but still we still have our own things to look after. And one of the things which makes it still difficult, of course, is if you say you have this plan, so you determine your goals and you put financial means to it and you start working, but the way we finance global health, international health, is still through the WHO, to UNAIDS, the Global Fund, Gavi. That's where the money goes. It's not that all the money goes to this strategy and that we then implement this strategy. So, and it's not that there is then all of a sudden another 50 million we can use for this. So there's still a lot of work to do in streamlining our efforts. And we have 3 priority areas under our strategy. That is, well, a very broad one is strengthening health systems, one is pandemic preparedness or international health crisis, and one is climate change in health. That climate change in health was added actually on request of our former minister, who was from a very liberal party and who very much believed in that we should address that issue because it's very real, and both in mitigation and in adaptation. So we try to work on fighting climate change, but also making our systems at home ready for that. And then I get to your question actually, is say, what does that mean then if you have a new government with new perspectives? Well, that's challenging, of course. The good thing is that the strategy is there, that we see in Parliament still that there seems to be agreement that this should continue. But it's when you get a new government with ministers from another political signature, very often they're not very fond of products or instruments or strategies that were from their predecessors. So, well, we're still trying to find out where our ministers stand in that respect, and both the Minister of Health and the Minister of Development Aid actually are both from the same party, which is a more national insight than the one we had before, which has a very global outside. So we're still finding our way in what we can do and what we can't do, for example, and talking about sexual and reproductive health, which is part of this strategy as well. We see our colleagues from Foreign Affairs struggling with the terminology they use, for example. And you say, is this about words? Yes, sometimes it is about words. We are struggling maybe with finding the right approach to climate change and health. So yes, political changes do matter. And we always think that we as the civil servants, we just keep the train on the tracks, because you might have elections within a year or you might have elections in 3 years, we don't know. But it's maneuvering, that's what it is. And at the same time, I don't think there's any politician in the Netherlands from any party who does not see that health in the Netherlands is affected by health in the rest of the world, that the position of our country is determined by the way other countries look at us, because this government, and you present it as a major shift, and in a way it is, but on the other end, it's also just a government. And it's also not that it's stupid people or something that come up with all kind of strange ideas. No, our support to the EU and our dependency on the EU is still very much within this government, and there's nobody that denies that the world out there has impacted the Netherlands and that we have to engage with that world and that we can do good in that world. And that's why we use this global health strategy still, and I hope that we can continue doing that. And one more remark before I give you back the floor is that we try to focus on a few areas, and then the colleagues, they do the same. But what do you do then with other issues? Yesterday evening we had a dinner and I sat next to ladies who were taking care of hypertension and diabetes. And they said, yeah, we go to Malawi or to whatever country in the world and they say that diabetes is such a problem. I said, yeah, it's not in our strategy. What does that mean? That we do not care about it anymore or do not focus on that anymore? So there needs to be flexibility in your strategies, and you need to always, it should not be blocking you from doing the right things at the right time.
Great. Thank you, Roland, for making that last point in particular, because I think there's also a misunderstanding on what a strategy does sometimes, to say we only do this, right? But a strategy, if it's well developed, that's where you use your kind of core capacity. That's where you would ideally also make sure most of the funding flows towards, and it guides your decisions. It doesn't mean you can't do the other important things as well. But what we currently have in the global health space is a bit of everybody does everything, and everything's a priority, and therefore we're really struggling to, as I think Lorena has implied, kind of pool our resources and do more together collectively and do it in a more focused way. I would like to open up the floor in a second, and I see hands going up, and that's great. But I do recognize we haven't talked about impact, so I would actually challenge the panelists a bit, and this might have been my fault because I didn't pose it in the questions. If you could think of one very granular example how you would define the success of your strategy. So please, no long statements. Can you think of one thing? It might be, the COVID certificate, something very, very clear, because I think it's also interesting to see, to Beate's point, like who is the audience? Whom are we trying to achieve impact for? I think might come out in that as well. So I will start with the State Secretary, and I'm sorry to put you on the spot, but define it how you would like. What would impact of your strategy be to you, and how would you define that success in a concrete way?
Yeah, very, very happy to respond to that question, but allow me just a very brief comment on what Roland just said. I would say Roland is the perfect example of the benefit of having civil servants, because the government changes, but the civil servants remain, and this is what we developed since the Middle Ages, to be independent from the king, and to ensure continuity. So he is the perfect example of doing that, and it's good. It's good to have that systemic approach, that we need the continuity, especially in global health strategies. It would be a drama to reinvent the wheel all 4 or 5 years after a general election. And that is what we are for and we stand for. And on the impact, and in my view, we should really ask the question how we can change something in reality. What makes the difference in reality? And this is very much linked with what you all said about indicators and measures and how we can measure our targets. And by the way, I just got the indicators and measures from Jérôme, so I have the French plan and implementation with me, and we will put it together, as we always do it, between France and Germany, and consolidate our measures, and then we reach out to the Netherlands. And afterwards, then also, to the European Commission in that order.
Thank you for thinking.
As an afterthought, thank you. That was an insightful little trip through European national coordination and politics.
Yeah. But just a word on the impact. We have several objectives, and we will measure our impact and what we are doing. Just to give you an example that you all know, we work hard to see how we can make our health systems carbon-free. They now contribute, at least in Germany, by 5% to the greenhouse emissions of Germany. So we have clear targets to make that carbon-free, but of course we cannot disrupt the system and the processes. That means we need some time until 2040, 2045, which is a very long time, but again, we have to also ensure continuity. The second point is on what Roland mentioned on antimicrobial resistances. We have a clear target set by the heads of states in the UN Assembly to reduce them by 10% by 2035. And this is a clear target. We will work together with our colleagues because it will make a difference in reality. Maybe the most difficult target to measure is the systemic approach, where, for example, we are working closely together, all of us, with the Pandemic Fund, hosted by the World Bank, to really invest more in prevention and preparedness and rapid response of national health systems. So I guess we should all talk to the Pandemic Fund and the World Bank, how we can really measure the impact on the ground, and we should really do that.
Thank you, Dr. Steffen, and I think measuring impact is super difficult. I do want to respect the time of the audience as well, so if you can try to keep your responses it's an example, it's more just to think through what do you mean by impact and what success would be. Dr. Weinbach.
Yeah, for me to start with, beyond the objectives and the indicators we have, common understanding is a key issue. When we developed our strategy, first of all, we talked with third parties and the African region, for instance, or the Latin America region, to try to understand what they call respectful partnerships. That was very important, and we will continue that way to make sure that there is a common understanding on the strategies and the implementation and the impact, the common appreciation, assessment of the impact. Then I wanted to say, when we develop a strategy, it's never in silos. Actually, there is a huge request from our German and also Dutch colleagues, and that's the same with Sweden, to exchange on the complementarities and alignment, sometimes also to develop synergies between our strategies. And that was the same with the European Commission. France visited very regularly the Commission during the preparation of our respective strategy to make sure that there will be alignment, and when there is no alignment, there could be complementarities, extremely important. I will talk about the joint action that is funded by DG Santé in connection with other DGs, such as DGs ENTPA, DG RTD, but also the external action services of the Commission. This is extremely important. You will understand why, where we were starting from and what we try to achieve in trying to improve the common understanding. Can you realize that at this date, there is no clear knowledge on how much we are spending, what are the key projects, what are the priorities of the different countries, how they align together in the European Union. So this is one of the goals of this joint action, which started last year in March. There are 24 countries involved in this joint action, including Norway and Ukraine. Ukraine is a very interesting partner because they are receiving support from many, many countries, organizations, WHO, Euro, and they see dispersion also on the ground. As Europeans, we try to develop Team Europe initiative also to support Ukraine in strengthening their healthcare system. This is extremely important. This is not about competition. We, as French, cannot do everything in Ukraine, but we can work with Germany, with the Scandinavian countries and Latvia, Lithuania to develop partner project with Ukraine. That's a typical example. So this joint action, if you want information, after 10 months or 12 months of activities, we have already achieved very important results. Another very important thing is to be inclusive and to develop also exchange platform to prepare the EU position in the global health multilateral fora, because the unique voice of Europe following this common understanding will be extremely important to bring our values to the global community, but also our priorities and to integrate to fit well with the international context. This is very important. So we have leaflet to distribute with the progress here made after 12 months. This is important also to progress on this common understanding, knowledge sharing, communication, better communication on our activities, the meaning of our activities and the impact of our efforts, investments and projects in this global health endeavor. Thank you.
Thank you, Dr. Weinbach. I'm actually going to hold the other panel statements because I do know I promised an interactive session, so I'm going to stick to that promise. We have 2 roaming mics, and I will start with 2 women because women are severely underrepresented. Okay, we'll take all 3 of you here first. So the lady in the we'll start here in the front, and then we have the lady in the white and the, I think, black. I've got you. I'll start with you. Please keep your comment or question as short as possible so that you respect the space of other people, and if you can mention your name and if you have an affiliation.
Is this on? Yeah. Hi, Serena Cruz, Global Surgery Umbrella. I'm excited about this panel. I want to applaud these state representatives. And not necessarily to the dismay of this side of the panel, but I have to say this because there is an incredibly strong working model of your alliances cooperating. And that just took place in Essen last week at the inaugural European Global Surgery Congress. Where we struggle in this space is getting funding beyond instances. So within civil society, we had the Netherlands Society for International Surgery there. We had the German Global Surgery Organization, DTC, and we are working out of Lyon with the WHO academic because global surgery is about training. But what happens to your alliances when it comes to creating that space and capacitating? We need funds to go from the initial convening of this, from directly to implementers within Europe, not necessarily only abroad. So the question for you all is, how do funds get loose enough so that the European global surgery community or the European health community, whatever these silos are, how do we get access to that funding to do the work we do? And the last thing I want to say is that we've decided as a European community to host our next Congress in Tanzania in 2026 because we want to demonstrate bi-directional unity, and that's coming from your health alliances. So congratulations, but also answer my question. Thanks.
Thank you very much, Serena. We're going to collate a few questions and comments. So there was a lady in the, yes, with white in the back. Yeah, we'll start there and then work our way across.
Yes. Hello. I have so my name is Marie Chenet. I'm from the DG INPA, the Commission, and I was wondering, I'm really, really happy to see that decision makers have this willingness to discuss their respective strategies and to look for opportunities for discussion, for potential alignment also with the EU Global Health Strategy. I was wondering if the informal expert group, which has been launched by the Commission in 2012 and has contributed to the Global Health Strategy, would be actually an appropriate platform to continue this very, very useful and needed discussion. So, yeah, I would like to know whether it would be feasible. There is a next meeting on 6th of November. It's actually just tomorrow, but yeah, open question, would there be the opportunity to continue the discussion at this time? Thank you.
Thank you very much. Yes, please go ahead.
Hi, my name is Noor. I'm an infectious disease pharmacist in background, but I'm also an AMR, a carer of an AMR survivor. And I'm also a global health policy master's holder. And I'm just starting in the field, trying to understand how global health strategy at, for example, the EU level in your countries could collate with economic policy that can support stability in, for example, I'm from Lebanon, hopefully post-conflict areas. So wondering how, because health, of course, is related to economics, related to stability. So wondering, do you make your strategies in coordination with economic policies that go beyond just health?
Great, thank you. We'll take one final question, comment here in the front with the, yes.
Thank you. Thank you for the opportunity to participate in this Q&A session. My name is Mwajabu Mniga, and I'm coming from Health Focus, a German consulting company based in Potsdam. My question relates to the comment made by Dr. Beat, which I believe it makes tremendous sense to consider global strategies while designing and developing national strategies if we want to effectively leveraging these strategies. But then I'm interested to hear your thoughts on how the national differences, this is in terms of resources, development, and etc., impact the integration of these global strategies. Thank you.
Thank you so much. We're going to pause. I know there were a couple of questions and comments here, also on the other side of the room. And since Dr. Steffen and Dr. Weinbach have already spoken a bit more, I'm going to ask Beate and Lorena to respond here. So there was one on accessing funding and making sure that that's flowing to all of the organizations and associations in a more flexible way, and maybe also on the question on the EU group and where the health strategies discussions should, in your opinion, continue. And then Beate, I would love your take as well on the two latter questions on AMR and also on the follow-up question to you on global and national health strategies. So Lorena, would you like to start?
Happy to start. So, well, first of all, thank you very much. And it's a pity we didn't have much time because I wanted to react to some comments.
Take your time here too. The floor is yours. Hijack it as much as you want.
I could. No, it's fine. I think that many of the questions go around how to incorporate all the elements from different stakeholders into the strategies. And for that, we do have the Global Health Policy Forum. That is the forum to precisely have civil society, other international partners, private sector as well. I find the last question very interesting as well about health and economics, because we need everybody around the table to contribute to not only the implementation of the strategies, but also how to adapt them to the changing world. And it's one of the things I wanted to react. The European Global Health Strategy was designed precisely to be adaptable. And it has changing in the title. Mm-hmm. It was about how to make sure there's health for all in a changing environment as well. So I think that it's something very important and this is why it's long term. So to have it, I mean, it's 2030 is our initial deadline to have it very adaptable. And to include everybody. So voila, that's what I would say. As I was saying before when talking about the strategy, precisely having all regional, even local, involved is a way to make sure that precisely the financing is efficiently spent and distributed as well. So this forum is also a way to make sure that we listen to all these. On health and economics, even if I know it's a challenging one, I think that indeed having all in the shaping and the debate is very important. But I think that global health strategies are very important also for economics because, and I think the pandemic is the biggest example of how not getting it right has a huge impact in the economy. Mm. So if you get your global strategy right, then you are going to save a lot of money, and also the spending in public health is going to be better. Also, I think when you see now we're in this change of commission, and I was very interested to see that our president, when appointing the priorities, and you see the letter of mission for our Commissioner for Health, Commissioner designate at this stage, there is a lot of innovation in that letter. A lot of innovation, and I think that innovation is a way to also make sure you have the economic aspect there as well, because innovation is crucial for health systems, but also for the economy. So in a way you are killing two birds in one shot, but okay, that would deserve a whole other conference on that. I just wanted to mention this, and just to conclude, because I have the floor, measuring impact. I didn't mention the joint action because I knew Jérôme would mention it, but it's the only way. If we don't measure impact, we will not be accountable. And that's the only way to be credible and to show that there is an added value in doing everything we are doing. So we are indeed working with member states to see how we can measure it. Indeed. Thank you.
Thank you so much, Lorena. And of course, feel free to comment on the other statements as well. Beate, over to you.
Yeah, thanks. And thanks for a question that is a little bit more tangible, perhaps, because you're giving the example of the AMR framework. So I think what's important is that within the space of antimicrobial resistance, there is already an agreement that this is an international priority. So we've already, wherever we are in each country, decided that each country probably has this problem, although the capacity is limited to really demonstrate it in the same way. So there's a global and a national approach to the problem. And that means that each country is supposed to have an AMR implementation plan, and that puts you in a position where you, at the local level or the national level, can then see what means do you have at your disposition to implement that plan. And for me, that's an excellent example of how, wherever you are, you have an agreed shared goal, and you can then frame within that space what your country can do, what your hospital can do, what your healthcare center, whatever, can contribute to that. And you can build it up a little bit, and you can see where the gaps are. And where the gaps are in particular, you can ask for maybe help from other countries who also have it on their strategic plan to deliver, maybe funding, capacity building in that space. So, for example, at the Charité in Berlin, we have worked very closely together with the Bundesministry for International Cooperation to build capacity in the AMR space, particularly in the DRC and also in Rwanda, by having colleagues of ours go out and set up surveillance systems in microbiology laboratories. And obviously, this needs to be aligned with what the country has already decided what they also want to do, and it needs to feed into the means that they've made available, because we cannot have vertical interventions in this space. It needs to be carried by the assessment of the countries themselves, saying this is an area in which we also want to invest health systems resources, and ultimately it goes back to the whole big context of health systems resilience. But I think AMR is, for example, an area where this is already sort of filtered through. The other thing could be a plan for uptake of vaccines, which is also an international plan. So you want to get away from zero-dose children in various countries. So you put strategies in place where each country and their EPI systems can work towards a goal like that. And that is, again, aligns with investments into Gavi. And there I can see these examples, which is, I think there are many, and obviously I'm coming from an infectious diseases point of view, but maybe there's a national diabetes plan, maybe there's a national NCD plan. So we need to work with the ministries of health in the countries, whatever their means are, to try and help, implement the plans that they set for themselves in the context of a global health strategy. At least I'm much more of a bottom-up person there.
Thank you, and I think those are important points, and also building on Dr. Weinbach's point of how do you find impact. You should ideally not define it from, if you are working with an African country, from Berlin or London or Brussels. You should be defining it together, or ideally led by the country and their needs and context. So very, very important points. I'm going to take two more questions from this side of the room. Yes, please go ahead here first.
Thank you very much for the moderators and the panelists. My name is Israel Adekunle Balogun. I'm a PhD student, a medical doctor myself, and also a person with disability. My question actually looked at the strategies that you've been developing across your nationalities, across the European region vis-a-vis the low and middle income countries. The questions are, have you been taking cognizance of marginalized group, like persons with disability in these strategies? And second, do you have indicators on that? Because the challenge I've noticed over the years is this: when budgets are reduced, it's the marginalized group that are cut off oftentimes. So I want to know what strategies you are having to mitigate this for the future. Thank you.
Thank you very much. There was another hand up in the back on this side of the room, please.
It's done? Yeah. Florent from Delft Imaging, and I wanted to reflect a little bit more on the question about, or the topic on fragmentation. And we've seen individual pledges, individual strategies. In the session yesterday, it was also discussed when in translating strategy into action that certain resources available in one EU country might not be available to people from other member states. I was wondering if you could reflect on, hypothetically, in the future where there's no more fragmentation or far less, where do you see the most value add for the EU and the global health community? Or maybe translating it differently, what are we currently missing out on because of this fragmentation? Thank you.
Thank you very much. Very difficult questions. Roland, I'm going to put you on the spot with the disability question because I think, again, going to my opening remarks, it's always treated as a bit of a marginalized population group, but again, those statistics, 16% of the global population, it is not a marginal group. It's kind of really, really front and center of our work. Can you, off the top of your head, remember in the Dutch Global Health Strategy how disability, are they referenced, in the consultation process? And I hate to put you on the spot, but I'm going to do it. And I might put somebody else on the spot, so do rack your brains in that time.
Well, to start with, the sound in the room is really difficult. So I did not fully get the question of the first gentleman that spoke, so that's a bit, so I might not be addressing the right question in that respect. But it was about disability.
So how do the global health strategies, have they taken into account populations with disabilities? Did you also maybe have consultations?
Yeah. Yep. The difficult thing is, and then we get back to where we started, what is this strategy? We still have our development aid programs that focus on the poorest countries in the world. And this is not replacing this. Mm-hmm. This is bringing together the Ministries of Health and the Ministry of Foreign Affairs by focusing on communalities, by a strategic way of addressing issues in health in the world, which have maybe a broader impact than just people that face problems in a country. That might not be the answer that everybody likes, but that's what this is. How do we as a government align ourselves in making impact in the right way? So our colleagues from development aid are still investing in all kind of programs in poorer countries in the world. But again, that's not necessarily what this is. So we're not forgetting it. We see it and we face it, but that's not the aim necessary of the strategy.
Great. Thank you. And I think that's an important point you make, Roland, on the fragmentation is not just within the health sector, right? If we have a global health strategy and then a separate global development strategy, then we already have a bit of a disconnect even at that level. Dr. Steffen, would you like to respond as well to the question on fragmentation? Because the natural fit on what's the EU value add would be to ask Lorena, but I would like to get your perspective from Germany. Why do we need the EU? Can we at some point remove fragmentation in an ideal world? And if not, what does the EU in your perspective add here?
Yeah, it's sometimes difficult to reflect about an ideal world and to reflect about European added values when the Commission is in the room.
I was telling her I like that you ask him.
No, I would like to turn it around. I agree that there is a fragmented approach to many policies, including health policies. One of the reasons is what I explained at the beginning. all health policies are national policies because all patients are national patients. But this is not the end of the story. The end of the story is that, as we just discussed, we have to align our policies to have some synergies and to bundle our forces. But how to do that is, in my view, a very, very important question. And in my impression, that is not a one-size-fits-all exercise. That means fragmentation could also mean that we might have well-diversified approaches in place, different approaches, where maybe France might have another approach, another indicator, another experience than Netherlands or Germany. And I would never criticize that. The important thing is how to overcome the fragmentation in the sense of a learning process. We are all in a learning curve. So at the end of the day, I really want to see what are the benefits of the French approach compared to the Dutch and to the German approach. I want to learn it, you know, and that is why we have to sit together in Brussels or in Den Haag or in Paris to discuss the way forward. Not in the sense of harmonizing each and everything. The European Union is a great animal to harmonize many things, for many good reasons, by the way. The internal market is a great success story, but when it comes to quite, let's say, complex issues like global health strategies and how to develop national health systems forward and how to overcome the climate threats that we are all facing today, again, we also have to try and maybe error and then try again in the sense of a learning curve, and we very much want to be part of that learning curve.
Thank you so much, and I think that learning point is really critical. Yeah, thank you. Dr. Renbach, you wanted to add?
I have a very interesting story to tell about fragmentation. Okay. Because the joint action, well, is using innovation to overcome fragmentation. We are using AI and machine learning tools to dig into the many scattered and heterogeneous databases that contain information on key projects, on funding and expenditure on global health issues, and on funding opportunities also for specific topics and so on. So there is I would say it's almost big data, well, a huge source of heterogeneous information in databases that we can explore. The funny thing is that I'm infectious infectiologist by training, but I come from the rare disease field, and this is also to address your question on people living with disabilities, because we support a resolution for the next World Health Assembly on rare disease, for a global plan on rare disease. And this is also true for a global European plan on rare disease. We have European reference networks with Germany also and the Netherlands involved, but we need also an international plan, a global plan for rare disease. And many rare diseases are the source of disabilities, you know. So, when I was in charge of preparing database and cohorts of rare disease patients, there were many patient files everywhere, many registries, very heterogeneous, etc. And at Necker and Imagine Institute, we had developed a tool, a machine learning system based on AI to take the information from the patient in different databases, from Excel file to Word documents to more sophisticated database, to create a huge and uniform database on the patient information and everything that needs to be associated with the patients. So that's the example that when you move from an heterogeneous world with scattered information, you can, thanks to innovation, make progress. We applied the tool for rare disease patients to global health projects. It works the same way. You just put your database in the system and it reshapes the information. And it's called Dr. Cooper. We will present it in Rome in 2 weeks for the General Assembly of the Joint Action. This is open source. Any state including the European Union, can use it to improve the access to information and the presentation of information.
Great,
Innovation
thank you.
is also possible for global health strategies.
Great, thank you so much for sharing, and a little plug for the Berlin-based WHO hub for pandemics, which does very similar work coordinating the data on surveillance and epidemic preparedness. We are unfortunately running out of time. I do know there are more questions, and I'm very sorry I'm not going to be able to take them. But I'm going to make a couple of closing remarks because we are just a few minutes at time. First of all, I would like to thank all panelists also for their patience with going a bit off script, the way I tend to moderate, but it's always good to be on your feet when you have an ambitious strategy to make sure you remember the objectives, kind of remember what you are committed to doing. But I think we have a lot of confidence, and I at least am very hopeful, having listened to all of you, that you really feel like you own the strategy. You also have thought through things like the implementation plan, indicators, and seem to feel quite accountable for it, even if it doesn't always cover everything that your country does and funds. And I think that's maybe the first point, that the strategy really is not always fully comprehensive. I think many of you made that point. Many other funding streams might dominate. You would wish the money would flow towards the strategy, but it's not there yet. And I'm always struck, especially having also been on many sides of the table, why there's a certain lack of agency there. I mean, I think especially if you are in government, you are in a state secretary position, civil service, isn't that the place to decide, let's change this, let's make the funding flow to where we have prioritized issue? I would love to see that. I would also, just as a second point from this discussion, really like to remind all of us to keep an eye on impact and on the measuring progress and real health outcomes. And again, to think of Beate's question, who is the target audience? Whom are we trying to create change for? There's often a tendency in our communities, and it's a very natural and common one across many sectors, to focus on process and a bit too little on that real progress. So strategy processes do have a bit of a danger to attract attention to influence a paper instead of influencing the progress on the ground. So just keep that in mind while you are advocating and following these or working on the strategy processes. I think the third really striking point from this conversation was we do have shared goals. We do have those sustainable development goals. If we're taking them seriously, the regional and sub-national level strategies should be within that framing. The SDGs really are flailing and failing. And I think, again, it is our responsibility as all stakeholders and governments to make sure we're continuing to support the targets outlined in the SDGs, in particular for SDG 3 as well. I loved your point, Lorena, on making sure that we're willing to adapt where possible. I'm currently redoing our organizational strategy for Light for the World as well, and a key central element is agility. There is simply so much happening in the world that requires us to keep the focus on the issues we work on, to keep the focus on the population group and mandate areas, but at the same time acknowledge there are so many massive fundamental changes happening in the world, and if we ignore those, we will be very irrelevant very quickly. Two final points, measuring what counts. I think that is a really important goal for all of us, whether we are designing, implementing, or holding governments and regional bodies to account. If you do not have a quantifiable target, usually there's something problematic, and if you don't have a date to go with it, you should be asking a lot of questions. And I think we have enough ambition statements and plans out there and don't need more. And finally, to Dr. Steffen's point, we are grateful for all the Rolands in the world who keep the civil service going and create that stability, those counterparts for all of us as stakeholders. And we hope you will stay around for a long time still. And I hope everybody can share the thanks and applause to the work that this panel does. I will have to close because of time and because the next session will start. But join me in giving thanks to the panelists.